Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss about billing and compliance practice question, and these questions are very important for your 2025 CPC exam, and also you should be knowing that you can easily score 3 marks from the billing and compliance, and it is not about getting 3 marks. Why billing and compliance is very important? Because it is a foundation to be a successful medical coder. Okay, once you start working, we have to be aware about the billing guidelines and the compliance regulatories. Okay, we should know, we should have more exposure on federal insurance, commercial insurances, okay, and other billing rules. Okay, everything we will learn today. So first, let's focus on acronyms. So I have added some 10 to 15 acronyms which are very commonly asking questions and which are very important. Okay, so the first question is, what does HIPAA stands for? So HIPAA stands for Health Insurance Portability and Accountability Act. Answer is B. Okay, so whatever the acronym I have added here, please you should also have enough knowledge, like you should have more knowledge on each of the acronym that I have added here. Say for example, if I say HIPAA, you should also knowing that the importance of HIPAA and when HIPAA was established. Okay, HIPAA was established in 1996 and it's a federal law. Okay, so it is there to protect privacy protection and security standards for the patient health information. Okay, so all of this extra information you should be knowing. And if you are really interested to learn billing, so you can comment your email or you can text me on WhatsApp saying that you need my live class recording. Okay, since I am also a medical biller, I have a medical billing recording videos, so I can provide that. And next question, what does PHI stands for? So PHI stands for Protected Health Information, okay, which is very important here. So you might get confusion between personal health information and protected health information, but the accurate answer is option C, protected health information. Okay, so again, so here if you should also be knowing that PHI indicators. So what does this PHI contains? So usually you can just the patient health information. So with that, he will be the medical record will be having patient name, patient address and their security number, driving license, insurance card. So many things will be there, including their medical diagnosis. Okay, so it should be protected. And as I said, the acronym for PHI is Protected Health Information. Next question, what is the full form of EOB in medical billing? So EOB stands for Explanation of Benefits, option B. And then what does CMS represent? CMS represent Center for Medicare and Medicaid Services. Next, what does ABN stands for? ABN stands for Advance Beneficiary Notice. And what does NCCI stands for? So NCCI stands for National Correct Coding Initiative. Option B. Okay, National Correct Coding Initiative. So as I said, what does ABN stand for? It's an Advance Beneficiary Notice. With that, in which cases we will initiate ABN. Okay, this is for a Medicare payer. When Medicare is denied to pay for such services, before providing the service, patient should get the ABN. Okay, that means patient should agree that patient will be responsible for the payment for the particular service. Okay, so that is called ABN, Advance Beneficiary Notice. And coming to NCCI, as I said, National Correct Coding Initiative. So here also it's like a tool. Okay, so we use this tool edits to get the or to unbundle the services. Okay, so like it will be with whenever the provider is performing two procedure in a same session, we should have this look NCCI edits. We need to check, okay, whether we can build this two service in a same session or do we need any modifier to bypass the edit. Okay, usually 59 modifier we will be using to bypass the edits. And in NCCI, there are 3 indicators. Okay, you should know all of those. But for examination, the acronym is enough. But to be a good medical coder, this billing and compliance is like a foundation. Okay, we should know the all other aspects of billing, and like we should have a good knowledge on insurance, federal insurance, commercial insurance, as well NCCI edits, the tools that we use. Okay, so all of these are important. And when it comes to NCCI, there will be column 1 CPT and column 2 CPT. So whenever we are assigning modifier, we will assign modifier to column 2 CPTs. Okay, so as I said, I have explained everything in deep in my classes. So if as a demo, you can request me a no live class recording. So next, what does BCBS stands for? So BCBS is a commercial insurance. BCBS stands for Blue Cross Blue Shield. And then what is the full form of OIG? So this is very important. So OIG stands for Office of Inspector General. Okay, option A is a correct answer. Office of Inspector General. Also, like a question, they can ask a question like who will be, the volunteer officers. So OIG will be a voluntary agency, we will say it. Okay, so what does they do? This OIG people. So they are responsible for overseeing and enforcing the compliance with laws and also regulations. Okay, everything related to Medicare. Like they do audits, they will do audits on various kind of concepts or various kind of the projects, and they will find out any kind of discrepancies or the education is needed for anything. Say for example, ENM coding. Okay, if they take audit on ENM coding, few will be following some other regulations or rules, and few will be not following properly, and then they will see like how many down coded claims, how many up coded claims, and then they will educate all together. Okay, so that is the role of OIG. And next, what does RVU stands for? So RVU stands for relative value unit. Okay, not revenue value unit. So its answer is A, relative value unit. And what is NPI in healthcare? So NPI is a number, okay, which can be given to individual provider, also which can be given to a group facility. So here NPI stands for National Provider Identification. Okay, so each provider will have a unique 10 to 11 digit number that is called NPI. Answer is A, National Provider Identification. Next question, what does LCD stands for in medical billing? So LCD stands for local coverage determination. Okay, local coverage determination, not local coding determination. Okay, answer is B. And you should know this is like LCD is like a medical necessity, and local coverage means it's a state law. Okay, local state, like each USA, like in the USA, each states will have their own LCD policies. Like they will define for the particular service what are the DX that we can link. Okay, so it's all about medical necessity. Next, what does NCD represent in healthcare compliance? So NCD stands for National Coverage Determination. Answer C. Okay, National Coverage Determination. This is again related to medical necessity, but it is about national. Okay, not it restricted to, not to restricted to state, but it's throughout the USA. Next, what is the full form of GSP in medical billing? So GSP stands for Global Surgical Package. So here you should know like what are the GSP modifiers, and again how many days will be there in a minor procedure as a post-operative. For minor procedure, usually it will be 0 to 10 days, and for major procedure 90 days global period will be there. So that means like during post-operative period, if patient coming for follow-up, then the provider should not charge for follow-up. Okay, the follow-up must be related to an initial procedure. And also you should know the modifiers like 24 modifier, which is unrelated ENM service during the post-operative service. And same way you should know 58 modifier, which is staged procedure during the post-operative. And 78 unplanned return in the post-operative period. So all of this global surgical package modifier you should know. Next, what does HIE stands for? HIE stands for Health Information Exchange. Okay, Health Information Exchange. Next question, what is the full form of RBRVS in billing? So RBRVS stands for a resource based relative value scale. Okay, option B. And next question, which of the following place of service code is reported for fracture care performed by an orthopedic physician in the ED? Okay, so place of service for ED emergency room or emergency department is 23. Okay, and place of service is very important. And for the CPC exam, like every year, there will be one POS question will be there. Okay, so this year the POS question is about outpatient, on-campus outpatient facility, that is 22 POS. And again, with that, you should also knowing office visit is 11. And again, coming to urgent care facility will be place of service is 20. And yes, that ambulatory surgical center is 24. And telehealth, okay, telehealth other than home 02, telehealth from home 10. Okay, so if you have any doubts regarding POS, in the CPT book, page number 3, okay, so in the examination, if you get POS and if you don't have any knowledge on that, please go to page number 3 in the CPT book. All the POS are listed there based on the location where the patient is seen. Okay, ED, outpatient, all of those, you can easily get the POS. As I said, I repeat, POS is very important. POS stands for place of service. Next question, which of the following is an example of fraud? So fraud means unknowingly doing. Okay, knowingly, just to gain more money, the provider is doing some kind of fraud. And abuse means unknowingly doing. Okay, so one fraud scenario will be there. So you can check this scenario here. They are asking which of the below scenario is fraud. So if you see, option B is reporting a biopsy and excision performed on the same skin lesion during the same encounter. Okay, usually biopsy is an integral component of excision. Okay, only excision will be coded on the same session, not biopsy. So here both biopsy and excision are built. So this will be considered as fraud. Okay, option B is correct. And same like this kind of scenario in your practice questions, please go through and identify what scenario would be fraud and what scenario would be considered as abuse. So next question, which of the following statement regarding advanced beneficiary notice is true? So as I said earlier, ABN is generated for Medicare insurance. That ABN will specify that the Medicare is not responsible for the paying particular service. Instead, patient is responsible. Okay, so the patient should agree that yes, I am responsible for the particular service and I am ready to pay for that service. Okay, so here in the options, if you see, option C is correct. An ABN must be completed before delivery of item or service are provided. Okay, before taking the particular service, say for example, patient wants one DME, okay, durable medical equipment, but in the Medicare beneficiary plan, DME is not covered, like it's not there in their plan. So Medicare will say like DME, we will deny it, we don't pay for the DME service. So patient will be aware that the insurance will not pay for that service. So patient should agree and he should sign the ABN. Okay, patient should sign the ABN. So whenever we see the signature of patient on ABN, there is a modifier. Okay, there is a modifier we will be appending, that is GA modifier. Okay, it is important as well. Please remember, when you see the signature of patient on ABN, you should append GA modifier for the particular HCPCS code or the CPT. This is important. And next question, which of the following is an example of electronic data? So answer is option A digital X-ray. Okay, so all options are like available in electronically, but the digital X-ray. So here sometime X-ray will be in film, X-ray film. Okay, so whenever they need digital X-ray, like it will be like an electronic data. Answer is A. Next question, which of the following health plan does not fall under HIPAA? This is important and most asked question. So answer is C, workers compensation. So worker compensation will not follow any HIPAA regulations, but other insurances like all federal insurances, Medicare, Medicaid and other private plans, so everyone will be following HIPAA regulations. So with this worker compensation, you should also remember two more insurances. One is automobile insurance and one more is property and casualty insurance. Okay, so these three insurances will not fall under HIPAA regulations. And also when I said Medicare and Medicaid, please be aware about the eligibility criteria. So for Medicaid insurance, it will be like they'll provide for low poverty people, and Medicare insurance is the people who are above 65 year, and if patient is having ESRD, okay, or patient is having any physical disabilities, like irrespective of age, regardless of age, they will be getting Medicare insurance if the patient is having any kind of physical disabilities or ESRD, that is end stage renal disease. Okay, eligibility criteria of federal insurance is very important. Next question, according to the OIG, internal monitoring and auditing should be performed by what means? So earlier I already told you what OIG will do. So this Office of Inspector General, they will be monitoring and they will be overseeing all the coding things. Okay, so auditing should be performed by what means? So answer is periodic audits. Okay, this audit should be done at least 3 months in a year, like every 3 months audit should happen. So answer is periodic audits. Next question, what form is used to send provider's charge to the insurance carrier? So here providers means it's an individual provider. Okay, individual provider will be utilizing the professional claim. So answer is CMS 1500. Okay, CMS 1500 we will be using for providers. So if it is comes to IP, they will be utilizing UBO4 form. So for this particular question, answer is C. Next, what type of health insurance provides the coverage for low income families? So this is like below poverty. So the people who are having limited income and who resides in USA, they will be getting Medicaid insurance. Okay, and answer is A, as I said. So if you see commercial PPO and commercial HMO, please go through this insurance also, because PPO means preferred provider organization, HMO means health maintenance organization. Okay, both are having their own different premiums, like PPO will have higher premium and HMO policies will have the lesser premium. So all the commercial plans will have these two type of policies. A patient can choose based on their conveniences. Okay. Next, which of the following insurance covers prescription? Prescription drug coverage will be covered by Part D insurance, Medicare Part D insurance. Okay, so these Part A, Part B, Part C and Part D are the parts of Medicare, and you should also know about all of these individual parts. Okay, where Part A covers IP service, inpatient service, And Medicare Part B covers outpatient service like the doctor visit and any kind of minor procedures on the office visits. All those outpatient service will be covered by Medicare Part B. And Medicare Part C is like it's an unique plan which can be maintained by MAC carrier. Okay, Medicare Administrative Contractor. Like we have a separate rules for Part C. Sometime it can cover IP service and it can cover special services. Okay, like vision and other cosmetic things, everything can be covered in Part C. As I said, it's a separate rules. We have to check the MAC guidelines and then we will be checking Part C. And lastly, Medicare Part D is purely responsible to cover the prescription drug management. Okay, so please go through all of the parts of Medicare. Next question, what is the patient's rights when it involves making a changes in personal medical record? Okay, so here patient wants his medical record. Usually he cannot access his medical record. Only provider will be aware about the patient medical record, and we medical coders also we will be having the access, and later payer. So if patient suspect any kind of, like if the bill is maybe overbilled, but the patient knows that he has not taken that much service. Okay, at that time, yeah, the patient can request. Okay, so patient can request and then the patient will get his medical record. So answer is B. They should be able to obtain copies of the medical record and request the correction of errors and mistakes. So once they see their complete medical record, say for example there was like one service patient has not taken, but in the medical record the particular service has been entered, so patient can revert it and he can question that this particular service I have not taken, why it is there. So corrections can be made. Next question, local coverage determinations are published to give provider information on which of the following. So here answer is D, reasonable and necessary condition of coverage of an item or service. So it is about medical necessity. So when you start working, you will be aware about LCD and NCD guidelines. So we will be checking for every CPT. We should check the LCD diagnosis and everything, and then only we will follow, because LCD is like a more many people will forget to follow LCD rules, and many coders will not check LCD. Later will end up in denials. It will generally not come in rejection. LCD rules or LCD errors will come in denials. Okay, so it was like it's a big impact. So you should have a good understanding on LCD policy well. So yes, that's all guys. Thank you for watching. So if you find it useful, please do like, and if please do share with your medical coding friends and subscribe to my channel. So if you comment that you are liking my video or if that is useful for you, definitely I can come up with few more topics. Okay, like it's not so easy, being a working professional and every day I have to take classes, and in this I need to sit and prepare PPT, and then I have to explain, record and post, so much time it will take. So for that we really need more motivation. I am telling behalf of all the medical coding content creators. Okay, I don't know about others, but for me it is generally it will be having like a hectic things. Okay, so yes, thank you for watching.